Does tirzepatide cause sweating? It's a question that comes up a lot for people starting Mounjaro or Zepbound, and it matters because if you're noticing unexpected sweating during treatment, you want to know whether it's the medication, something else going on, or a sign that you need to call your doctor. So let's break it down clearly. First, the straightforward answer. According to FDA prescribing information and clinical trial data, tirzepatide does not directly cause sweating as a recognized side effect. It wasn't flagged in the SURPASS trials for type 2 diabetes or the SURMOUNT trials for weight management. There's no established pharmacological mechanism by which tirzepatide would directly increase perspiration. But, and this is important, some people do experience sweating while taking tirzepatide. The key is understanding why. Quick background, tirzepatide is a dual GP and GLP-1 receptor agonist. It works by mimicking two naturally occurring hormones that help regulate blood sugar, support insulin release, slow digestion, and reduce appetite. It's FDA approved as Mounjaro for type 2 diabetes and Zepbound for chronic weight management. The most common side effects are gastrointestinal, nausea, diarrhea, vomiting, constipation, and abdominal discomfort. These tend to be most noticeable during dose escalation and often ease up as your body adjusts. Now back to sweating. If it's not a direct drug effect, what's causing it? The most clinically significant cause is hypoglycemia, low blood sugar. Sweating is actually a classic symptom of hypoglycemia, along with shakiness, confusion, and feeling lightheaded. This is especially relevant if you're taking tirzepatide alongside insulin or a sulfonylurea, since that combination increases the risk of blood sugar dropping too low. Ask your clinician how and when to check your blood glucose if you notice unexplained sweating. Gastrointestinal distress is another factor. Nausea and vomiting can trigger a physical stress response that includes sweating. If you're going through a rough patch with GI side effects, that could be what you're noticing. Dehydration is also worth considering. If GI symptoms are causing you to lose fluids, it can impair your body's ability to regulate temperature, leading to heat intolerance or feeling overheated. So what should you do if you're experiencing sweating on tirzepatide? Talk to your doctor. If hypoglycemia could be the cause, your healthcare professional may want to review your treatment plan. If your sweating seems tied to nausea or GI symptoms, let them know. Your clinician may adjust your regimen to help manage those side effects more effectively. And if you're not staying well hydrated during periods of nausea or vomiting, that's worth flagging too. Now, when do you need to seek help right away? Get medical attention immediately if sweating is happening alongside chest pain, severe abdominal pain, signs of a serious allergic reaction like swelling or difficulty breathing, or symptoms of severe hypoglycemia that aren't resolving. Tirzepatide also carries some serious but rare risks, including pancreatitis, gallbladder disease, and acute kidney injury, which can result from dehydration caused by GI side effects. These aren't common, but they're reasons to take new or worsening symptoms seriously and contact your healthcare professional promptly. Quick recap. Tirzepatide does not directly cause sweating according to FDA data and clinical trials. If you are sweating during treatment, it's most likely linked to a secondary cause, hypoglycemia, GI distress, or dehydration. Hypoglycemia is the most important one to rule out, particularly if you're on other blood sugar lowering medications. As always, this video is for educational purposes only and is not a substitute for personal medical advice. If you have concerns about any symptoms you're experiencing on tirzepatide, talk to your doctor. They know your full picture. If this was helpful, drop a comment below. And if you want more content like this, like the video and subscribe to the channel. We'll see you in the next one.